We have a special guest this morning, and very pleased to have Governor John Bel Edwards joining us. And Governor, we know you've got a busy day, so we'd like to invite you to lead off our meeting and address our organization.
Thank you, Don, and thank you, Terry, for your leadership. I appreciate everybody who has served on the commission, all the individuals on the various task forces and other folks who have informed the deliberations and the recommendations that have come forth. As you all know, in April, I created the Resilient Louisiana Commission because the COVID-19 public health emergency had hit us the month before. And the charge to the commission was to determine how do we make the state of Louisiana more resilient in the face of COVID-19 and other crises. Didn't know at the time that we would actually have 3 hurricanes make landfall later in 2019. And many other tropical storms and hurricanes actually impacted us. So it has been a very difficult year for the state of Louisiana, for everybody, whether you're young or old, whether you're in business, whether you're an employee, it doesn't matter. It's just been a tough year. And so your work has never, is extremely important, is what I was trying to say. And so the charge really was to figure out what recommendations you all would make for reopening the economy safely. And secondly, what are your recommendations for making Louisiana more resilient in the long term? So we had a short-term and a long-term focus to your work. I know that the challenge is complex, but it's also critical to our future. I know that even absent COVID and these hurricanes, we've always been challenged, and like every state, I suspect, but probably more than our fair share of challenges of things that we've needed to address for a very long time. In May, the commission produced the first report with preliminary recommendations for reopening Louisiana's economy. Obviously was based on health, science, and the data that we had available to us, public health recommendations from various experts. And I want you to know that that first RLC report absolutely informed our decision-making on reopening Louisiana's economy. It's a very difficult thing to do, but what we've always tried to do is to strike the right balance between protecting public health on the one hand, and then having our economy open to the maximum degree possible, consistent with the public health imperative, for the benefit of businesses and industry and employees and for the benefit of the state. And no matter where you strike that balance, reasonable people can say, well, you should have been on this side a little bit more, or on that side a little bit more. But I think overall, we've done a very good job, and we've adjusted over time as the situation has allowed and as we learned more. This was a novel coronavirus. It's new. The medical community, the scientists, they didn't know much about it. Still, there's an awful lot that we don't know, but we have learned a great deal since April. As we continue in phase 3, I have now received the commission's report of long-term recommendations. And so this is a comprehensive game plan for a more resilient Louisiana. And this is where I really want to express my deepest gratitude and appreciation for the work. More than 300 citizen leaders serving on the commission and its 15 task forces, covering every sector of life in Louisiana, and many more citizens contributed their thoughts, their time, their effort to inform this report. And I encourage the general public, elected officials, the private sector, really everybody, to join me in embracing the spirit of the report and acting upon its best recommendations. And some of those recommendations can be implemented with policy changes. Some are going to require legislation. Some of that legislation will be easier than other areas, and I guess that should come as no surprise. But that's where we are today. Is we're going to try to distill this down because, as you all know, it's a very lengthy report with lots of ideas. Try to figure out the best recommendations, categorize those as whether they can be implemented through executive action, through legislation, or other ways, and then get about doing these things. Now, as for next steps, let me say that I view this document as the people's report about how we can make our state safer, stronger, and better equipped to bounce back from challenges. I say that because of the diverse citizen-led work really from all across Louisiana that has gone into formulating this game plan. Literally examined every sector of our economy, and they've dedicated their expertise and passion to this effort over the past 8 months. I think if you look at the commission, we have tremendous diversity, whether it's geographic diversity, gender diversity, racial diversity, the diversity of thought that comes from having public sector people, private sector folks, you name it, every sector of the economy being involved. And so we can rest assured that the viewpoints and interest of Louisiana citizens overall have been considered and are contained in these recommendations. Now, resilient means that we have the capacity to bounce back quickly, and I absolutely believe that. And inherent in that bounce back is the sense, the goal, the determination that we're going to be better than we've ever been. We're going to be stronger. It's not going to be automatic, and we're going to have to be deliberate and intentional. We're going to have to be focused and committed to doing this. But I am very optimistic that we can make this happen. We didn't know when our COVID-19 response started that we were going to have historic challenges from Hurricanes Laura and Delta and Zeta. And a lot of people missed this because it happened, a lot of people, especially across the country, missed it because of the way the national election was playing out. That was kind of consuming all the oxygen in the room, right? But Hurricane Laura at the very end of August is the strongest storm to ever make landfall in Louisiana, or at least since 1856, the fourth strongest ever to make landfall in the continental United States. So never has resiliency been more important for our state, our people, our future. We're going to continue to recover across Louisiana, especially in Southwest Louisiana. We're going to be learning new lessons about resiliency every single day. But from the commission report, I do want to highlight some hallmarks of this effort to build a more resilient state. Number one, broad public input has established that this effort is one that all Louisianans can own and hopefully embrace. Number two, equity is essential. Our state succeeds when the full access and opportunity reach every person in Louisiana, no matter their race, gender, age, or background. And we really need to make sure that we have equality of opportunity. And look, we can't guarantee equality of outcomes, but we should be about making sure there's equality of opportunity. Economic diversification is critical to building and maintaining a resilient state so that Louisiana is not overly reliant on a single industry or one or two or three, but really across this many industries and sectors of the economy. Fourth, Louisiana will capitalize on our sources of economic strength. And there are some things that we can do to look at the future, anticipate where the world economy is going, the U.S. economy, and what we have to do now to be successful in competing on the global stage. The recommendations in the report fall under 6 overarching categories. Those are equity, inclusion, and quality of life. Also, digital access and physical infrastructure. Third is access and opportunity in education. Related to that is number 4, workforce development and continuing education. Fifth is small business and entrepreneurship. And number 6 is government support. I look forward to sharing more in the near future about how we can take action to make Louisiana an even greater and more resilient state. And I want to again thank all of you for your work. I will tell you that your work is not finished as a commission, as task forces. For one, COVID-19 is still very much with us. I do know that you're going to get an update on that. I want to say, as governor, that I appreciate the work that you all have done as we have tried to lead by example and make sure that Louisiana citizens across the state take this pandemic seriously, understand the role that they have to play in order to protect themselves and their families and their communities. And I know that after 8 months or so, COVID fatigue is real, but that doesn't mean the virus is going to leave us. In fact, it's just to the contrary. We're now well into our 3rd surge, a surge that, if you look across the country, could be and likely will be worse than the 1st or the 2nd in terms of positivity, case growth, hospitalizations, and yes, unfortunately, deaths. And that's despite the fact that we have made tremendous improvements in the way the medical community cares for victims of COVID-19. The overall mortality rate is down, but if you have enough people get sick, the fact that fewer of them will die doesn't mean that you won't have more deaths overall. And this is despite the fact that we now have therapeutic treatments, both for those who don't need hospitalizations and those who do. We've made advances on the use of mechanical ventilators and other breathing devices and so forth. And as we look forward, we can be optimistic that that soon we will have at least 1 and probably 2 vaccines that we can begin to administer. Pfizer announced that today they will be seeking emergency use authorization of its vaccine from the FDA. And then we will have the advisory committee that will issue its guidance on who should be and should not be vaccinated with that particular vaccine. We know from General Perna and Operation Warp Speed that we will start receiving the vaccine in state a couple of days after the EUA is authorized, or at least that's the plan. And so I think we can all assume that some point in December, next month, probably in the second half of the month, we will start receiving our allocation and start administering the vaccine, first to healthcare workers, and then secondly to individuals in nursing homes and assisted living centers and so forth. So and that's all positive. I do want you to know that the number of vaccines we're going to have available is going to be relatively limited at first, just because the production isn't where we would want it to be, not because of anybody's fault. This is the fastest the vaccine will have ever been brought to bear. But what I'm trying to let people know is our fight is not over when we start administering this vaccine. We're going to be months and months and months trying to administer this vaccine broadly enough across the state so that we can achieve the herd immunity that we're looking for and finally begin to put this crisis, this public health emergency, in our rearview mirror. And between now and then, we have to do what the Vice President asked us to do on Monday, joined by Secretary Azar, Dr. Redfield of the CDC, Dr. Birx, Dr. Fauci, and that is we have to bridge to the vaccine. And when you have this unprecedented surge, that means we have to adhere to those things that we know work. We have to look at the mitigation measures. We have to make sure that the restrictions allow people to achieve the physical distancing that's required to reduce transmission. Wearing masks is critically important. And we now know it confers a benefit on the mask wearer, not just those who are in close proximity to the mask wearer, staying home when we're sick, washing our hands, protecting the most vulnerable, getting flu shots, all of this really, really important. And so we're asking all of you to embrace this, make sure that every sector of our economy, every one of these task forces, that we continue to message this, because the longer the public health emergency goes on, the more people really engage in fatigue. We still have some people who are minimizing the danger posed by this disease. We have some people who deny it outright. But ultimately, we have to be responsible leaders and strike the right balance. That's what we're trying to do. Finally, before we get to questions and answers, in less than a week, we're going to have Thanksgiving. You may have seen that the CDC came out yesterday and advised against traveling for Thanksgiving. That should tell you all you need to know about this current surge and the threat to public health that it poses. Secondly, it's not just traveling. Nobody's Thanksgiving, and by the way, I'll just go ahead and say it, nobody's Christmas this year should look like they have looked in the past. We're multi-generational family members joined together at the same table in the same households for various holiday-related activities. That is a very dangerous thing to do in light of this surge. And so I'm encouraging everybody to have the patience and the discipline necessary, and to understand that just because someone is your very, very close friend or relative, if they don't live in that same household with you, there is a very real danger. And the danger is more real, more pronounced today than it was before, because the community spread is so much higher, as evidenced by the increasing positivity rates. And we have added more than 250 net new hospitalizations across the state just this week. Just this week. And so we're on a trajectory right now that, quite frankly, we've got to get off of it. If people would distance and wear their masks, we know that it will work. So I'm asking for your help on that. And I want to complete my prepared remarks by going back and thanking Don and Terry for their leadership. Thank all of you for your work. And then I'm going to make a commitment to you all that this work that you all are submitting with this report, we will implement as much of this as we can, as quickly as we can, so that we do achieve the desired result of building a more resilient, more prosperous Louisiana for everybody.